everybody. Okay, so I'm trying some new techniques here, but my main goal is to get you exposed to some of this equipment. Sorry, there we go. So this is the Chattanooga, the manufacturer, Intellect Shortwave Diathermy 100. And this is the unit, and this is really a cart that goes with it. The actual component is this, but the students over the years have nicknamed this R2D2 because it looks like a little robot of some kind. Anyway, what's kind of cool about this is that this thing can rotate to whichever direction we need to set it up. It also has a drawer down here. It has a drawer, and this is where we keep some of the equipment, and because it's an electric device, we need to plug this thing in. Okay, let me get this plugged in. All right, so first of all, we need to turn this thing on. And what comes up is clinical protocols. And this is the easiest way to do it. The other option is thermal dosimetry. So dose 1 is really a thermal dose. Dose 4 is the most thermal. Everybody see me full on the screen? Okay, I just want to make sure because I'm getting, okay. All right, so these doses here are based on the thermal dose. Dose 4 is the most thermal. Dose 1 is the least thermal or athermal. All right. So, but what's really cool about this equipment is that what you can do is you can just hit the clinical protocols, and it's going to give us an anatomical chart. And what we do is we match, let me see if you can see that. You get the anatomical chart, and what we match our patient with the anatomical area on the equipment. So today we're going to do low back. So I'm going to go right to the low back. And then it's going to give us some choices here. And hopefully you can see that okay. The choices are pain relief, contractures, decreased joint stiffness, increased blood flow, chronic inflammation or inflammatory condition, synovitis, which is includes tendonitis and joint capsule involvement and ligaments, or reduced muscle spasm. So for our purposes today, we are going to do reduce muscle spasm. And then right away, it's going to show us what the dose is. So the dose is dose 4. It's going to be 20 minutes. It's going to be pulsed at 800 hertz for 400 microseconds and 150 watts. So it's already it's pre-programmed for these clinical indications, and it makes it really easy to use that way. All right, I'm going to demonstrate a couple of other things before we do that. On this part here, this is the safety line. So we give that to our patient. They can hold it in their hand, and they just give it a little bit of a tug, and it will discontinue the treatment. This is the cable. It comes from the equipment and it goes down into our monode or drum. Sorry, this arm is a little loose right now. So this is part of the induction method of diathermy, and this is called the drum or the monode. And as I mentioned in lecture, what's inside there is a whole network of cables that emit the radio frequency once we put this on our patient. So let me get us a patient. Come on over your patient. Go ahead and lie down, face down. You guys seeing this okay? All right. Okay. So we've identified the treatment area. There's no contraindications. I've already screened this patient for contraindications. There are none. And what we're going to do is we're going to bring the waistband down a bit. We're going to use our alcohol prep swab to wipe down the treatment area. We're going to get our cotton towel over the treatment area. And again, the reason for that is that due to the thermal effect, it will increase perspiration at that tissue, and we want the towel to absorb the perspiration. Now, I'm going to set this up right over the patient. And I'm going to turn the drum, and we're going to place it right over the low back here. Okay, so it's actually in contact here, and that's good placement. Now, if you're ever using this equipment on different tables, you got to make sure that the table that they're on is not made of metal. Sometimes there's stainless steel tables that have a little bit of padding over it. This one is wood, so I'm not concerned. But you got to make sure, because if they're laying on, especially if it's just a plain metal table, that could be disastrous. Okay, so I want you to take this, hold this in your hand. That's the emergency shutoff. And now we've got the settings. And all I have to do at this point, and this is what that looks like. You know, let me go from the other side, because I think hold on. So there's the setting there, and here's the cable. It's hard to tell where this is going. But let me go back to this drawer here. In here is this little device. And what it is a little fluorescent tube. And once we make sure everything's okay, I'm going to hit the start button. And it starts initiating . Okay. So, on a scale from 0 being no warmth to 10 being extremely hot, I want this to get to the point where it's about a 6, maybe a 7 max, okay? So if it gets any hotter than that, I need you to let me know. All right. Now, this is a fluorescent tube, and the purpose for this is to identify if the equipment is actually working. And so what I can do is I can take this and place it next to the cable, and you see how it lights up? It's kind of hard for you to see, but believe me, that's lighting up here. So remember I said that it can emit quite a few feet away, and that's why you want to keep things away from the cable as well. And then here we are on the drum, and you can see that it's lighting up. So basically the energy from the electromagnetic energy from the drum is causing this this fluorescent tube to light up, and even a few feet away here. And this is just a way to check and make sure that the equipment is actually working. I don't know if you guys can see that it's lit up or not. It's hard to see. But anyway, that's the purpose for the fluorescent tube. Okay, good. All right, and now at this point, I'm going to go back and show you the screen. So this is, again, it says low back, reduce muscle spasm, dose 4. And here's the time remaining, 17 minutes and 5 seconds. The average watts is 48. The maximum is 150 watts. And it's got the monode at 400 microseconds, 800 hertz, pulsed for 20 minutes. That's the treatment. And for this particular patient, this equipment, we can save the protocol, and each patient has a treatment card that's basically, it's kind of like an ATM card, if you will, that is inserted into this slot right here. Now, I don't think we're using this, we were using them in the clinic for a period of time, but I don't think that's I think that's no longer the case. But with this equipment, you can save that protocol and put it on this card, and it stays with the patient file. So you just have to put that in, and it'll reset the same treatment protocol. So that's for recurring treatments. Okay, and that's it. That's diathermy. I put on the I put on your lab modules some other shortwave diathermy tutorials that involve, I recall the knee was one of them, so, and possibly a shoulder, I'm not sure, but that's basically the gist of it. Now, if I were to discontinue this treatment, it'll turn off by itself. Then I would just take the drum off, I would wipe the skin, and that would be it. And then reschedule the patient. Okay, any questions? All right, there.
I saw you recording the lecture before, and I was just wondering where you're posting those on campus.
I'm posting them on the modules for the week that we do them on. So like today's lecture, I haven't posted that yet. I will be posting it later, and I'll put that on week 4, and I'll list it as the lecture recording, Zoom lecture recording. And I'll do the same thing with this.
Dr. Yarmus, another question. I know you can't use ultrasound at the same time as diathermy, but while this treatment's running, would you potentially interview the patient about other topics, or if the ankle was free, do a not ultrasound treatment on the ankle, or do you kind of just let them hang?
Yeah, so the golden rule is we don't want to perform ultrasound and diathermy at the same time on the same patient, and it's It's a bit conservative, but it is a good, especially when it comes to board questions, good clinical safety. But you could do them, you could do one after the other if you wanted to.
Or would there be other therapies you would do concurrently, or would you really just let them get their diathermy and then?
So one of the benefits of diathermy is that the patient gets really relaxed. So if you're doing another therapy on them, like you're doing muscle stim on their lower extremity or something like that, that could certainly, it would take away from the relaxing feeling that they were feeling from the deep heat in their lumbar spine, for example. So clinically, you'd have to determine whether the benefits, were worth it. But you could certainly do low volt stim, and you could do laser on another body part. So those are, and you can certainly do ice or other forms of heat through hydrocolators or ice packs or something like that. You wouldn't want to do constitutional hydrotherapy concurrently because that would not work out well.
And last question is that, have you included craniosacral therapy to enhance the relaxation effect during diathermy?
That's certainly something that you could do, and the only thing that I would say is here's our patient, here's the drum, here's their sacrum, here's the cable. So if I'm here, I'm going to be really in close proximity, so I'm going to be dosing myself with some electromagnetic frequency. If you wanted to do just cranial therapy at the other end and working on that, you can certainly do that, and that would certainly enhance your treatment. So you just want to position yourself in a way where you're not exposing yourself to the electromagnetic frequencies.
Thank you.
All right? Okay, shall we call it a day? I'm calling it a day. Good luck on the exam, and we'll see you next week.
Thank you.
Bye for now.